My name is Ben Danielson. I'm a pediatrician who's worked in this area for 22 years. And I was reflecting a lot on what it has meant to me to think about health. Like, what is health? I remember as a medical student at the University of Washington really thinking that health was really about these technical skills and bits of knowledge that you learn in a classroom or a lab or a hospital. It was about those amazing technologies that allowed you to build a liver in a refrigerator or create the special snippers that can change your DNA. I thought it was all about that kind of technology. I thought it was all about a healthcare worker who was sort of coming in to rescue people or save lives. That was part of my education when I was coming through medical school and residency at Seattle Children's. I really appreciated what I learned there, but I have to be honest and say, I learned the most about what it's like to be a physician by actually being part of a community. And I know now that it's the communities themselves that define what health really is. I know that it's really about being connected to community that determines whether or not you're going to have a life that's thriving and beautiful and full of experiences that lift you up and make you a better person. Not so much about the technology that happens in those few moments when you're in a hospital. I remember being a young doctor and thinking, wow, I really need to be the smartest person in the room every time I'm taking care of a patient. I need to come with all the answers, and I need to show that I really have the knowledge that the family needs. I remember one early experience when that just started to really flip on me and sort of slap me in the face about how ridiculous it is to think that you always have to be the smartest person and know all the answers. What a fallacy that is about health and wellness and health care. There's a Somali mom who I was seeing her two preteen boys, and near the end of this checkup, she informed me that she was going to be sending the boys to Kenya for a few years to be in school there. And I was just trying to be so kind of cool and on top of it and knowledgeable that I jumped in right away and I say, oh, I totally get it. You want your boys to go to Kenya for a few years because they're becoming adolescents. You're worried about them being on the streets. You're worried about how America sees black and brown young men. All these things are true, right? But I was jumping in with my answer because I wanted to be smart and be cool and hip and on top of it. She was a nice, kind mother who indulged me in the way that wonderful mothers do. She let me talk on for a while, and then she eventually smiled and shook her head and said, I'm sure you're a very nice doctor. I'm sure you've been trained very well, but you're absolutely wrong. I'm not sending my boys to Kenya because of the streets of Seattle or South Seattle. I'm sending them there because the schools are better in Kenya than they are in South Seattle and South King County. And it set me back on my heels. Not only was I preaching something that I thought was smart about the streets, but she was teaching me something about what it really means to promote the health and the future of your child. And it blew me away, that reality that education might be better somewhere else, that experiences are not so well framed in the American Washington, Seattle space as they are informed by broader experiences outside this space. That we have a shameful education system in so many ways that could be improved and made more relevant and practical and educate our young people in a better way. Well, it's just one example of these times when I would walk into a room as a young doctor, think I had all the answers, get sort of sat back on my seat and had to really reflect and learn, and it took me a while before these black grandmothers and these Somali moms and these Latina aunties finally kept teaching me the lessons that I really needed to learn. That health comes from communities. That communities know best what's healthiest for their kids and their children. That their love and their knowledge about their children's needs far exceeds any textbook training or time I spent in a class, in an operating room, in a hospital bed. These are the kinds of experiences that I think we need to embrace and understand. That it's the strength of communities that create the strength of people. That is the diversity of people in communities, contrary to some of the messages that I feel like we've been hearing these years about one culture, one definition of America. It's actually the multiple definitions of this country that make up the strength and the beauty and the power that is, at the bottom line, health. And so I think about Southeast Seattle, and what I realize is it is the intersection of the world. It is the space where so many cultures come together and learn about each other and understand each other. And as a pediatrician, when I see that and I think about that through the eyes of a young person, what I realize is the prospect for health, for true thriving, for understanding what the world is and being a part of it that is making something better out of our future. That comes from spaces where many cultures are recognized and honored and revered and learned about and celebrated and built upon each other to create a true world community. And there is no place I know of that says that more strongly than Southeast Seattle. For some issues of healthcare, they cover every element of our lives. One of them is really about business ownership and the opportunity for businesses to be thriving within communities rather than outsourcing to something national or something far away from your own interests. If you have a pharmacy that is part of your community, that pharmacy helps your community grow and be better, understands you and your needs in a way that a national pharmacy is just never going to do. It has the ability to respond to cultural and family and local dynamics in ways that other broader, bigger pharmacies can't accomplish. I feel like activities like the community health boards have helped to build businesses and sustain businesses related to healthcare within communities, actually strengthening those communities by that process. And I think the Somali Health Board and Somali-run pharmacies in the Othello Square area are just a great example of how that idea of taking ownership for your own health, taking ownership for your own community's well-being and wealth, and bringing those ideas together in order to create something better, like a thriving pharmacy that's in your neighborhood, whose name and whose faces and whose ownership and staffing are people you know, that's magical. The power of community-owned health businesses is so important, especially during times when things are really difficult. If you're having health issues arise throughout your community, if you're having economic factors start to affect you in your community, I just can't help but think about what Ahmed has done with his Somali pharmacy in the heart of the Othello Station area, and how he's been able to respond to families' specific needs around how to make sure that they have adequate access to testing for COVID, how to make sure that they have adequate resources and a place to understand why it is important to get a flu vaccine, how to help begin to have conversations that are so hard sometimes for any of us to have. But when you trust somebody like Ahmed and he is saying, hey, we need to talk about mental health and mental health issues in our elders, mental health issues in our children, that's a conversation that you're going to sit down and listen to if you're part of this community. That's a conversation that doesn't feel as connected to you. If it's someone from far away, a white person who has great authority at a hospital but has nothing to do with your community, that's a very different kind of experience. And I'm so proud of people like Ahmed who are building and rebuilding community every day by understanding the health and social issues that are rising up even in our midst and finding ways to solve them in ways that are relevant and trustworthy, credible, and effective all at the same time. He acts as a bridge from the traditional healthcare system to the traditions of our neighborhoods. He acts as a navigator and a translator for the language of healthcare and the challenges of healthcare delivery to the languages that are local, the traditions that are local, and the experiences that inform how we make every one of our decisions. The privilege of living in a multicultural neighborhood, of being in part of a community that really understands many different cultures, prepares you for the world in a different way, prepares you to be able to interact with people with many different backgrounds with a sense of comfort and understanding. It allows you to enter spaces that are completely new to you in a way that allows you to navigate them in an especially fluid manner. I think about young people going to college, and because they lived in Southeast Seattle, because they heard from people with many different experiences from across the spectrum of race and ethnicity and language and socioeconomics, because of those early experiences, they are super students in college because they bring those experiences with them into a space that might also be very, very culturally dynamic and have people from many different experiences. When I think about what I hope for the future of Southeast Seattle and things like the Somali Health Board and spaces where people are owning their own wellness for educational experiences, I think that this is such an important launching pad, space of growth from which to explore the world. I really hope that we create ways for that also to be a place to come back and get reinforcement and get supported when you need to. I think about the amazing Somali heritage medical students I see at the University of Washington right now, and I do wish and hope for them that they have mentors and elders that they can connect to very easily within their home communities like Southeast Seattle, who can support them on those hard days when medical school doesn't make all that much sense, or when it seems like they're not understood by the teachers, professors, and students around them. This idea that it allows you to launch to great things, do different kinds of things, go to colleges and spaces, expand your mind and your education, but also that there's a link back and that you can come back and find trustworthy, credible, safe, honored, cherished people who cherish you and support you in that experience is really, really important. There's work right now with the University of Washington School of Medicine students. They're doing this all themselves, who are Black and Somali heritage, creating mentorship circles in communities like Southeast Seattle, and really making sure that those connections stay strong. Sometimes going just a few miles to a university is like cutting a cord, and it feels like 1,000 miles away. What I think we really need is for that to really be a really flexible cord that also allows you to come back when you need to, for the support and the growth and the reinforcement and the inspiration. Because what you're bringing back when you finish your training is a different kind of knowledge, a different resource for the people around you, and the ability, like Anissa Ibrahim, one of the very best pediatricians in this city, to really be there for her community and for other communities to learn about her experiences and her culture in really valuable ways. This is about spreading ideas and seeds by having a multicultural experience within a neighborhood and a community, and having that be so rich and so strong that wherever you go, you still feel connected to it. And that's really important. As I've mentioned, I've been very interested in making sure that schools and education and healthcare are really tightly interwoven for the sake of our children. And so I'm really trying to live into that, and I've met so many wonderful teachers throughout our school systems, especially in Seattle, South Seattle, and South King County. They're just really dedicated, caring, skilled people who enter those spaces and do amazing things for the future of our children. I also wonder if they work sometimes in environments that are designed to sort of be one-size-fits-all. And often when you try to do something in a one-size-fits-all manner, you actually create something that fits no one in any particular good way. I wonder how understanding communities and the multiculturality of communities could inspire our educational systems to learn to grow into being much more culturally and community-centric. How to weave in the lessons that could be learned by community elders who don't carry titles, who don't carry degrees, who aren't necessarily formally part of education systems, but have experiences that are more valuable than any PhD. How do you make sure that an elder and a child spend time together and share wisdom within the school system so that they know that a multi-generational experience is part of lifting them up and setting them off into their future? I wonder if schools could learn how to create experiences that are more intimate than 40 children being faced by one teacher, trying to teach all of them with their many different levels of skills and abilities, all at the same time? How do we reinvent school so it is mentorship woven into it, that it is apprenticeship kind of built into it from the very beginning, that it is relational, that you're building relationships that are close enough with a teacher that you feel like they have such a strong stake in your future that you can't help but succeed? How do you make sure that a school system sees all the talent of all the teachers that are working within it and really centers their voices, asks them, what do you need to do your work better? Instead of, how can we standardize everybody's work to be the same? I think about the opportunities we have to create a different kind of experience, and I think just like we've seen communities own their own healthcare, I'm really looking forward to those days when communities own their education so powerfully that the experiences within Southeast Seattle are truly relevant and part of the broader life of Southeast Seattle, and that the children understand and are educated in ways that are so meaningful to them that failure is not an option. Unfortunately, I think we live in societies, wherever you live, whatever community you're in, where there are folks who often suffer in silence, who are unseen and unrecognized by schools, by healthcare, by other systems, for the needs that they might have and the strengths that they might bring as well. I think about the disservice we often do to communities with disabilities, young people with disabilities that are emerging, and how those might be having them fall behind from a standard educational perspective, and yet not being realized for the kinds of accommodations and support services they need in order to really thrive. I wonder how we as communities can start to recognize each other and see each other for everything that we are. Not just the deficits that we have, but the strengths as well. Not just the ways we conform to some standard, but the ways that we diverge and what's beautiful about that. How do we create a space where we recognize earlier when a child has a hearing problem and that that's impacting their language skills and that that's impacting their learning abilities? How do we create a space where it's okay to have a different set of behaviors that should not mean that you're kicked out of school? It should mean that the school should bend and make accommodations for your behavior to be something that still is functional and still allows you to learn. How do we create the extra services that some of us might need for our speech or for our physical abilities, such that a beautiful school with a lot of stairs is not a barrier to somebody who is in a wheelchair, or that our chance to really listen and learn and express ourselves is not held back by challenges we have with speech. This is the kind of future that we all need to be arcing towards. These are the conversations that I think a super community with lots of different cultures, lots of different voices and experiences like Southeast Seattle should be leading the rest of the nation in having conversations like this. We recognize the differences around us. We see each other for who we are in addition to what other cultures and things we bring. And I think that means that we can also recognize all of the differences, the different abilities, the different experiences, the different ways of learning, the different ways of physically moving around. We could be leaders in having those conversations create a different form of society, of learning, of healthcare for every child, every adult, every elder around us. I believe that's really important. Communities like ours have to be sure that we do the work we need to keep heritage and culture alive. I hope that every family whose roots go really recently back to another country, who've spoken a different language, do every possible thing they can to make sure that their children continue to know that language. I hope that one of the most important lessons I've learned in my life is to listen to your elders, listen attentively to the things that people say, because it drives the way they're going to behave and it teaches you how to be a better person. I remember hearing these words from an elder in healthcare, a former Surgeon General, and she said something like, you can't keep an uneducated child healthy, and you can't keep an unhealthy child educated. That education and health go so closely together that if you care about education, then you have to care about the health and the work that I do. And if I care about health, I have to care about the work that happens in schools. Schools for children are the spaces and places where, combined with the best supportive nutrition and activity and other things developmentally, that's where health happens. And as I went through my life and work, I started to notice how healthcare is often separated and siloed from other components of a child's life. And a child just goes through their lives. They don't notice the silo that is the school, the silo that is the clinic, the silo that is the dentist's office. These are all related experiences for them. And so they should be for us as well. Which is why this idea of really building healthcare practices that reflect the developmental process that young people go to and through as they get ready for school is so important. School readiness, it should be a measure of how well I'm doing as a doctor. School readiness, the very measures that a school uses to assess whether a child really has the tools and skills and aspirations and dreams that it takes to be a successful student, I should be in that business. I should care about making sure that happens correctly. You can find so many different experiences within this small space, and it's a space that has been intentionally created within, not defined from the outside, sustained and cultivated to be a place where many cultures can come together and coexist. That is powerful. That's a lesson I wish our politicians knew better. That's a lesson I wish our healthcare system understood better. It's a lesson I wish our educational system really understood better. Those are the seeds of wellness. That's where health comes from. That's the lesson that I learned from these moms and grandmas and aunties, and it's the kind of lesson I want to carry forward and support, not as a person who knows all the answers, but more as a person who is continually learning and growing and being better able to contribute to a greater good with so many people, because there's so many languages and voices and family structures and spiritualities and ideas and languages and laughter that together, that's what makes health. That's what health is. I know all of that came after my very technical training. I know all of that came because I listened to incredible moms and parents. I know all of that because I'm inspired by kids who look at me and see the world and say, I can do incredible things if you support me at the right time and if you get out of my way at the other times. That's my little lesson, and I think it's so true about the way the best communities are built. And if you want to see an example of where the best communities are built, come to Southeast Seattle. Walk around, take a look, walk along the Chief Sealth Trail, find yourself a space in Othello Park, head up to New Holly, wander around and see the families, the languages, the spirits, the cultures all working together, seeing each other, appreciating each other. Spend time at a fair where you might see Indian dance in one direction and the Somali line dance in another. This is a space where cultures come together. This is a space that enriches your life in a way that money cannot count. This is a space where health happens.